On October 14 and 15, 2011, the conference was held at the University of Toronto Medical Science Building about epilepsy and a different kind of treatment.
Good morning, everybody. I think we're going to get started. My name is John Park. This is my wife, Ellen Novak. And there's Trevor Park. Just got the note.
Over 50 million people around the globe suffer from epilepsy. It is imperative that this information is passed on to patients and doctors everywhere.
The reason that we're all here today is that Donna Andrews taught our son Trevor how to control his seizures.
If you are watching this video, you have vital information that will ease the suffering of others and give them their lives back. As someone who is in a position to help others, you are obliged to do so. All eyes to the front. Class is about to begin.
We've learned that epilepsy is not a disease but a symptom, and the Andrews-Reiter technique helps to find the cause of the seizures.
It is our great hope that others can get this kind of help and freedom, what can be crippling from our fears, and we also want to spread the vast and valuable knowledge of the Andrews-Reiter technique to health professionals and patients so they can incorporate some of their methods into practices and patients can adopt it. Welcome, Dr. Joel Reiter.
As a neurologist, I notice this is a physiologic disorder. This is something that's not there all the time, and so maybe we can do something different with it.
Neuropsychologist Donna Andrews has described herself as terminally educated. 3 master's degrees and a PhD. After contracting encephalitis when she was a young woman, having multiple seizures daily, she asked herself not why she was having so many seizures, but why she wasn't having them all the time.
I was a vegetable. I was an epileptic. I was supposed to be sick the rest of my life. Over the last 31 years, I've been studying the brain and seizures. And what I've found out is that the brain has a mind of its own.
Is self-control of epileptic seizures possible? How does it work? Mind over brain. Maintaining intentional control, remaining in charge of the situation is essential for preventing the seizure to progress.
Because every case is so individual that actually you teach the therapist something about your condition. This method really describes the kind of doctor that I want to become, a doctor who recognizes, who gives responsibility to the patient and recognizes the patient's ability to know what's best for him or herself. And I want to learn from my patients.
Who would you listen to? Alright? Someone who's never had seizures and offers you drugs in the hope that you'll stop convulsing. Or someone who's been through this illness, knows exactly what you're going through, and has actually overcome the problem.
My epilepsy came around with benign brain tumor. I've actually had 3 brain surgeries. I've also been on tons and tons of drugs, and way too many drugs, and way too high of doses.
I want to leave you with the message of hope and intention to heal and cure.
I have my daughter back. She was a zombie for about 10 years, and now she's the person she was before.
Treat people as individuals. This sounds simple, right?